And as we bring in Senator Grassley, here's a look at how supporters of the president's plan are trying to pressure the senator in his home state of Iowa.
That's the president's plan. Keep the coverage you have now or choose from a range of plans, including a public health insurance option to lower costs and keep insurance companies honest. Why is Senator Grassley opposed to giving you a choice? Tell Senator Grassley it's your health. It should be your choice.
And Senator Grassley joins us now from Waterloo, Iowa. Thanks for joining us this morning. Senator, you heard that commercial, the president's supporters trying to pressure you in your home state. You also heard David Axelrod on the president's preferences for what should be in the plan. Bottom line, is there any kind of public health insurance option you can accept? And will the plan you negotiate meet the president's pledge not to raise taxes on people earning under $250,000 a year?
Well, a Democratic senator has come forth with a co-op plan that if it's along the lines of what we have known co-ops in this country for 150 years, and that would definitely bring additional competition into the insurance industry. I think that if it's structured along those lines, that we could have yet a different option than what we presently have. And we're looking at that, and we're trying to get a bipartisan agreement on that. And if it doesn't touch the concerns that we have about federal control of health and leading towards a Canadian-style single-payer system, then I think it can get bipartisan support. But let me assure you that we're trying to find a bipartisan compromise in this area as well as every other area. And I'm not so sure that the competition is a major thing that we have to deal with in order to get a bipartisan compromise. George, if I could say what the overall view of my party and most everybody in Congress is to make health insurance affordable and accessible. And when we say accessible, we mean taking away the discrimination that comes from pre-existing conditions. And when we say affordable, affordable for people that have pre-existing conditions and also affordable for low-income people. And lastly, to bend the curve of growth of health care, because we can't keep on this gigantic increase in healthcare costs that we have.
But how about this question of how to pay for it? You know, you saw the president during the campaign said he's not going to support any tax increase for people earning under $250,000 a year, but you and other senators, including some Democratic senators, are working on this plan that would take away some or cap the tax deduction for some health insurance that employers provide. Can that commitment the president made be kept? Or will you have to raise taxes on people earning under $250,000?
From the standpoint of the president saying that he doesn't want to do that, I think it's going to take presidential leadership to get people of his party to see that we shouldn't be subsidizing high-end health insurance policies that drive up inflation in health insurance, maybe 1 or 2 percentage points of the 7 or 8 that it goes up every year. So I'm asking, and I think the White House knows my view and the view of a lot of other Republicans, since the president denigrated John McCain's effort to move in this direction during the campaign. It's going to take, in order to win over Republicans, presidential leadership in that direction. Let me give you the overall view, though, for financing. We Republicans and most Democrats believe that it ought to come from within the healthcare industry. So if you read about $1 trillion, we're talking about reshuffling dollars within healthcare to make healthcare affordable for people that don't have it and for high-end, high-cost health insurance. We want to bring money from within healthcare, reshuffle it. So we're going to get money from the high-end health insurance policies, and then we're going to save hundreds of millions of dollars within Medicare that's being wasted. Just as one example, the administration announced that they just arrested a dozen people that were involved in $52 million of fraud within Medicare. We've got to do things about that, and shifting money from it being wasted to more useful sources within healthcare the direction that we're going to go, but all from within healthcare, not from outside of healthcare.
Let me turn to the issue of energy. You heard Mr. Axelrod talk about the House passage of the cap and trade legislation. He said that this Republican charge that this is a broad-based tax increase is a phony issue, and he challenged Republicans, including you, to come up with an alternative.
Yeah. Before I answer that question, I want to comment one thing on Mr. Axelrod said about Republicans' input into the Health Committee's bill. He said they put in 83 amendments. Let me assure you, those were no policy changes in policy. Those were strictly technical, and Republicans are not going to be hoodwinked into that being a bipartisan bill.
So you don't
now,
buy
to answer your question.
Well, let me just follow up on that,
Go
though.
ahead.
You don't buy the White House definition of bipartisanship?
You stated my position accurately when you were interviewing Mr. Axelrod, that when we're restructuring 16% of our economy, that's what healthcare is, and when we're affecting every person in this country, because this is every person in this country, then we ought to have bipartisan support. Senator Baucus, my chairman, that I'm working with on a bipartisan proposal, wants it to be overwhelmingly passed in the United States Senate, and that means bipartisanship, just not 3 or 4 Republicans going along with 58 Democrats, but a sizable number of Republicans, and I think we have the capability of doing that if people put policy ahead of politics. And remember, policy is the best politics. Now I forgot your other question.
It was, he said that the issue of taxes on the energy plan is a phony issue, that it's a negligible tax increase. And he did point to these Congressional Budget Office numbers, which show it's only about $150 in 2020 for an average family.
Well, you have to give the Congressional Budget Office, because they're like God around Washington when they say something. But I'll tell you, earlier this year, we had economists telling us that when you filter all these increases in energy through every step of the economy, manufacturing a product or whatever services might come, we have come out with about $3,000 for a family of 4. Now, I won't argue $175 versus $3,000, because that's not the most important issue. You got to look at what's happening to our economy if we put this very strong tax on energy. The people that have been complaining for 10 years about the outsourcing of manufacturing jobs to China are the very same ones pushing cap and trade. And you're going to find signs on manufacturing doors, if this bill passes, that says moved, gone to China. So what we have to do is make sure China, the #1 emitter of CO2, not the United States, China is, and India right along with them, we've got to have an international agreement so that we have a level playing field for American manufacturing, so we don't outsource any more jobs. This should be done in a way that affects China the same way it affects the United States. Because if the United States moves ahead by itself, we're not only going to lose those jobs, but the point is, after 30 or 40 years, we're going to reduce CO2 by less than 1%.
Okay.
So we got to do it on an international basis, George.
Senator Grassley, thank you very much for your time this morning. I appreciate it. Good to have you back.
Thank you.
Good to see you, sir.